Right. Hey guys, my name is Joe. I'm a physical therapist with FX Physical Therapy, and today I'm here with Noni Bell, a personal trainer in the area, and we just want to take the opportunity to talk a little bit about what this landscape has looked like over the last couple of months, a little bit about telehealth and also virtual training options that are available. So for those of you who are not familiar with FX, we are a performance PT company in the Baltimore area. We have about 9 clinics as far south as Severna Park, Columbia, Elk Ridge, and then as far north as Hunt Valley. Right now, I'm in our CrossFit Federal Hill location, so we actually have a treatment room right here in the CrossFit gym, which is awesome. We see a lot of fitness athletes. And being a performance PT, we're able to work with people who aren't necessarily actively injured, but who might just have fitness goals that they want to reach. Even if they are working with a personal trainer, we can still offer a lot of accessory work and different rehab type movements to prevent injury. So that's a little bit about me and FX, and I'll turn it over to Noni so she can talk about herself.
Hey guys, so like Joe said, my name is Noni Bell. I am a NASM certified personal trainer. I've been certified since about 2018 now. Prior to that, I was a physical therapy technician at a few different physical therapy offices. And that just kind of gave me my base, foundation, learning about anatomy and things like that. And that's where my passion for personal training came into. I train in the Federal Hill as well as Mount Vernon areas in the city. And I'm going to ask Joe a few questions. She's going to ask me a few questions, just things that you guys might be thinking during this quarantine time that you might want to ask us questions or whatever it might be. So we're going to ask each other questions, very generalized questions. And if you have any other additional questions that you may want to ask, feel free to send us direct messages or emails or whatever it might be. So let's get started. All right, first question I have for Joe is, how are you able to do work as a physical therapist virtually?
Yeah, so we do something called telehealth, which has been around for a while, but has been made a lot more popular recently for obvious reasons. So pre-COVID, we were, seeing people in the clinic one-on-one, in person only. And then for a while after we were mandated to shut down, we spent that time getting our eggs in a row for telehealth. And so now we're able to actually work with patients remotely. What that telehealth kind of looks like is just what you'd expect from your physical therapy visit, minus the manual therapy piece. So we are able to still go through progressions, look at your movements. We can even do assessments of home offices, home gym setups based on what equipment you have, and make recommendations based on that. So for a little while, we were doing strictly telehealth, and now we're kind of in a little bit of a blend of both. So we are open in our clinics. We're following all of the national and local guidelines on taking precautions and just seeing people in a one-on-one basis. But it's kind of nice to be able to have both options available right now. So similar question for Noni. With the transition to a virtual platform for training clients, what have been some highlights for you? What have been some unexpected pros of this?
Yeah, so the virtual platform has actually been a really cool transition, something that I didn't expect. So when we first heard about the whole COVID and everything closing down, I was really concerned about how business was going to go. As a personal trainer, it's a lot of in-person, hands-on type of work. So to have to transition to something virtually was something that I was a little hesitant and nervous about. But there's definitely been a ton of pros. I can say from the personal training perspective, I've definitely had to get a lot more creative than I would if I was in a gym. I mean, obviously in gyms, we have tons of different types of equipment and machines and things like that. So I know what my goals are for my clients and things that they have to work on. So it's a lot of creativity that has to come into play without having the equipment and things like that, which I personally think is a big pro. And then with my clients, I've noticed a lot better body awareness, because we kind of dialed back a little bit. They're still getting effective workouts, still sore and all those things, but we definitely dialed back. Not everybody has equipment and things like that at home. So I've definitely noticed that my clients are more aware of their bodies and things like that because they don't have access to the resources that they would usually have. So a lot of pros on both ends of everything, I think. All right.
Yeah, for sure. I also noticed with working with my patients, being able to see themselves in a camera in live time definitely adds to that body awareness. So instead of me having to cue everything or us having to do it in front of a mirror, they can kind of see themselves and be like, oh, okay, my hip is actually here. Let me fix that in real time, which is useful.
Yeah, it's been awesome.
Yeah.
So my next question for Joe is, have you still been able to see results with your patients since you may not have been able to see them as often, or because you're doing telehealth and you're not able to do that manual care? Are you still noticing progressions and things like that with your patients?
Yeah, absolutely. So I would say yes. I think that the biggest pro for telehealth and one benefit that I'm seeing is that we are able to really work on the patient empowerment piece. We're providing a lot of education to patients about their movements since we can't be in person with them and, provide that live. So we spend a lot of time on patient education, and we also spend a lot of time talking about just like their daily routine, things like sleep, stress levels, a little bit of nutrition and hydration too, making sure that all of those pieces are in line. I would say that with telehealth, it's kind of redrawn our focus to those pieces that we might not have been always asking about in person, which I've found to be greatly beneficial. It makes the care a little bit more well-rounded instead of just, bringing someone in to go through some exercises and stuff like that. So yeah, so I would say that we have seen some results in people just taking a little bit more ownership in their own care, and having to be a little bit more mindful about their movements and, their daily activities, whatever that may be.
That's awesome. I think a lot of people associate physical therapy with so much like hands-on touch and things like that. So I know a lot of people are probably curious as to how physical therapy would still be effective without those things. But I mean, I think it's awesome that you're still able to use different aspects, and it's not all about just like the hands-on stuff, but making sure mentally and all other aspects everybody's cool. So that's awesome.
Yeah, for sure. So manual therapy absolutely has its place, don't get me wrong. But for a lot of people, injuries come on because of a loading problem. So this gives us an opportunity to really look at a person's programming and like what they're actually doing, break down those movements a little bit more, and, kind of attack it from that side, which has been great. So next question for Noni that I have is, so we talked a little bit about the pros of virtual training. What has been the biggest challenge for you?
I would say the biggest challenge, minus everybody's situation is different. So I have clients who have equipment. I have clients who don't have equipment. I just recently started to do outdoor training again since the laws have been lifted and we're allowed to congregate in outdoor settings now. But because everybody's situation is different, I think that that's been the biggest challenge. I mean, everybody's living situation from apartment living to homes and different things like that. So sometimes space isn't there. The different movements that I would typically have somebody do in a gym, they might not have that space to do it in their home, as well as access to equipment. And then obviously your basic like technical difficulties and things like that. Like I just had one this morning actually. So those are like minor things. But again, I'm trying to look at as many of the pros as I can versus the cons with everything that's going on. Yeah.
Yeah.
All right. Next question I have. How should someone know when to seek out physical therapy?
That's a great question because there's a lot of misconception out there that you have to be actively injured or in pain to see a physical therapist, when in reality, we like to focus on the preventative care a lot. And performance-based PT, which means that, even if you're not necessarily having pain, or maybe you've had an injury in the past that you want to be a little bit more preventative about, we can definitely work with anyone in those situations. So since there's no like hard and fast rules about, when is the best time to see a physical therapist, we offer free consultations, so free 15-minute check-ins, and maybe look at some nuances of the movement that you might not be thinking of. So like how ankle mobility plays into overhead squatting and your shoulder positioning and things like that. We work with a lot of personal trainers to complement a person's training. So there's a lot to PT that is more than just, I have an injury, I want to get over it in X number of weeks. We tend to have a long plan of care, which is going to not only get you back to that pre-injury status, but hopefully improve upon it.
No, I totally, obviously I agree. I'm a little biased when it comes to physical therapy. I worked for so long, but I push my clients all the time. Even if, again, like Joe said, if you're not in pain and, you know, I can look at somebody and notice, okay, something's going on with their upper trap. We're not 100% sure yet. Maybe they should go to a physical therapist to get more answers. So I'm all pro physical therapy. And like she said, it doesn't have to necessarily be because you feel something. Like, don't wait for your bone to be out of your skin before you realize you need help. You know, if you're doing something and you notice something might not be 100% right, like Joe said, 15 minutes in a physical therapy office and let somebody evaluate you. So I 100% agree with everything.
Mm-hmm. Yeah, absolutely. Yeah, we found those consults to be really helpful, just giving people more information about, you know, how the ways that we can help specifically. And being honest with people too. You know, we've definitely come across people where we're like, maybe you should see a doctor first, maybe, you know, get this cleared out of the way if there's any red flags or any other concerns from that end. So yeah, so we're still doing those consults, so feel free to reach out if anyone is interested. So talking about virtual training sessions, can you loosely outline what that looks like for a client?
Yeah, so virtual training sessions have been pretty similar to how I would do it in a gym. I usually check in. That's the first thing I do. Ask the person how they felt after the last time I saw them, what they've been doing since then. Have they been, I'm a big fan of stretching and things like that. Not all my clients listen to me, but I tell them anyway. So I ask them, you know, how stretching has been, things like that. And then we basically get into the session. I've noticed that I like to outline my sessions ahead of time if possible. And I've been more likely to do that now, just because, again, not having access, I can't just go and throw somebody on a leg extension machine. I have to really think about what I'm going to do ahead of time. So it's pretty similar to what I would usually do in a gym. Again, checking in, but I've had to outline things a little more than usual, and make sure they have the proper equipment for the things that I'm about to tell them that they're going to do.
Yeah, for sure. And when you say check in, other than like checking in with how they felt after last session and what they've been up to since then, does anything else like go into that? Anything else that you ask about?
I'll ask them, like, if they had something going on, like, you know, they noticed something felt weird when they did a certain movement. I'll ask if they did something throughout the week to improve that. Did they do any heating or icing or anything like that? We would maybe even try the movement again at the beginning of the next session and see if it had any difference, or if it was just that specific day, or if I can make any type of adjustments or things like that at the beginning.
Great.
All right, my final question. Do you see the physical therapy industry changing once everything opens back up and life is back to normal?
Yeah, so I'm predicting that telehealth is going to be here to stay. I've had, just in my own caseload, a lot of people really appreciate the convenience factor. You know, they can just hop on their computer in like a HIPAA compliant, on a good platform, and we'll be able to knock out therapy in an hour, as opposed to them having to like actually physically go somewhere, you know, take more time out of their day to come to an appointment. I mean, I do think that we'll see a huge uptick in in-person appointments once it's safe to do so again. But I think for some people, they just really appreciate the convenience factor of PT virtually. Yeah. And so I think that will be something that we continue to use, which is nice that we have like more options for people who might have a little bit of a busier schedule, or, you know, for whatever reason can't make it into the office. So it's nice that we've had this time to really get the details smoothed out for telehealth, because I think that we'll continue to use it as long as it's safe to, you know, to do so, and there's nothing that indicates a person having to come into the office. And so similar question for you. Can you see yourself using virtual training even if gyms are opening back up?
I could 100% see myself doing virtual training. As worried as I was about it before, now that I've experienced it for the past few months, I think it's an awesome tool that I didn't even think about using until all of this went down. I think in addition to like convenience and people having crazy work schedules and I think once gyms do open back up, there are going to be a lot of people that are hesitant to go back. There are a lot of germs and things like that that pass through gyms. So I think that a lot of people are still going to be hesitant to go to the gyms, but they still want to stay active in the same way. So I would definitely see myself continuing virtual training. And then in addition to that, it allowed me to notice that there are a lot of people that are uncomfortable in gyms, not because of germs, but because of body imaging and things like that. So I think for somebody who may not necessarily feel comfortable being in a gym setting yet, virtual training is an awesome tool to use. Still get that person moving, keeping them active and things like that until they feel more comfortable to go to a gym. So I absolutely would continue to do it.
Yeah, absolutely. I couldn't agree more. And I think it's also a nice transitional tool that, allows you to ramp a person back up to being prepared to get back into a gym who may be, has the personality of they're going to go into a gym and do a bunch of reps of really heavy weight they haven't moved in a long time and then hurt themselves. So I think I could definitely see virtual training being a nice tool to progress somebody slowly and safely to being ready to go back into the gym and maybe do some movements that they haven't done in a long time. Yeah. So that is all we got for today. If anyone has any questions or requests or specific, comments about anything, Noni and I would both be happy to hear from you. We'll post our contact information along with this link. And yeah, I think that's about everything. Stay safe, everyone.
Yeah, take care.